in the assessment criteria of the speaking subtest. So there are no changes to the format of the speaking test, which means that the format remains the same. Initially, you'll have a warm-up section, and then you're going to perform 2 role plays of 5 minutes duration each. The speaking test will take about 20 minutes, and the structure of the test is remaining the same, but the changes are being made to the assessment criteria. What you see on the left-hand column is the revised linguistic criteria. From the present assessment criteria, one of the parameters, which is overall task fulfillment, it has been taken out. The linguistic criteria that will come into effect from September 2018 would have 4 parameters: intelligibility, fluency, appropriateness of language, and resources of grammar and expression. And all of these would be on 6 marks each. And a new communication criteria is being added, and the sub-criteria are relationship building, understanding and incorporating patient's perspective, providing structure, information gathering and information giving, and each of these are worth 3 marks each. Let's discuss the linguist criteria in detail one by one. For intelligibility, it means how well your speech can be heard or understood. And it deals with aspects, vocal aspects like pronunciation, intonation, stress, rhythm, pitch, or accent. And when I say accent, I'm not implying that you're required to have a particular accent. Different accents are acceptable as long as they don't impede the communication, as long as it doesn't hamper the communication flow in any way. So there are different things that you can do to improve this criteria. It's not just pronunciation, but intonation is something that a majority of students need training in. Intonation is the rise and fall in the volume or pitch of your voice. It can be used to emphasize the most important information or to signal when you're asking a question or a statement. For example, when you're asking a question, the intonation goes up. When you're making a statement, then the intonation, it goes down towards the end of the sentence. For fluency, fluency is how well your speech is delivered in terms of the rate of speech. So the flow of speech, or the rate of speech at which you talk. And pauses are very important in this. Pauses contribute to an improved understanding, and one of the weakness areas of students that I've trained is that they need to take a lot of practice to incorporate pauses at the right stage. I'd like to clarify something here about utterances. Some students believe that they cannot have any hesitations, or they cannot have any pauses during their performance. I think some repetition and hesitation or self-correction is natural and acceptable even for native speakers. The only thing that you need to avoid is don't have so many gaps or pauses that will impact your ability to be understood, because that would affect your score. The third one is appropriateness of language. It includes the use of suitable professional language and your ability to explain medical terminology or medical procedures in simple terms as necessary or as appropriately given the scenario of your cue card. What you should do to improve this criteria is to practice explaining medical and technical terms in appropriate language. And some common topics are giving general advice for good health and diet, or about losing weight, or smoking cessation, or caring for wounds at home, or medication compliance, and so on. And also consider how your language, your content needs to be adjusted to meet different patient types. For example, how your language, how your tone would change when you're talking to an elderly patient, or when you're delivering bad news to a patient, or when you're trying to talk to an angry patient, when you're trying to diffuse a situation, or as opposed to how you would initiate a conversation with a depressed patient, or elicit some responses from a withdrawn patient who's uncommunicative, or consider talking to a family member of the patient or a child. So your language, your tone, your fluency would have to be adjusted accordingly, and this is a part of this criteria as well. And then the fourth is resources of grammar and expression. This refers to the accuracy and the range of the language used. And I'm stressing on the word range. It means that you have to demonstrate a range of grammar in your OET speaking. Any student who chooses simple sentences, a simple grammar, or does not make any mistake is not likely to get a high score in the speaking subtest. You need to demonstrate a range of grammar. You need to choose some advanced grammar as well. So you need to incorporate a variety of grammatical structures. In other words, it's not just enough to not make any mistakes. Accuracies alone, it's not enough. You also need to demonstrate a range. So simple grammar as well as advanced grammar. And some tips for this criteria can be try practicing the question word order, because a majority of students make a lot of mistakes when they're asking questions while taking the history of the patient, or while when they're investigating the presenting complaint. And now let's see the communication criteria in detail. So the first one is relationship building, and relationship building has 4 sub-criteria. The first one is initiating the interaction appropriately. This means you should greet your patient in a friendly way, in a confident manner, in a welcoming manner to establish rapport with your patient. Second one is demonstrating an attentive and respectful attitude. This means some examples that I can think of are seeking the patient's permission or consent before asking questions, or moving on during the consultation. For example, before asking questions, you could say something like, before proceeding further, is it all right if I ask you a few questions? Or before moving on during the consultation from one task to another. So for example, when you're moving from the history taking stage to explanation or to treatment advice, it's important to take the patient's consent. Something else that I can think of is about being sensitive to patients when talking about embarrassing matters. You might have cue cards where it's mentioned or outlined that the patient is embarrassed, or the patient is uncomfortable talking about a particular topic. So in those cases, you will need to use indirect language, and indirect language can be used while asking questions, while investigating the presenting complaint, and it can also be used when you're suggesting treatment advice to the patients. So I've even put out a video on indirect language versus direct language on YouTube, and you should check that out to understand, to discern the meaning between how you can initiate interaction on sensitive topics. The third one is adopting a non-judgmental approach. This means being accepting and respectful towards the patient views, and avoid making any judgmental comments or statements. So that means if a patient is expressing their views or perspective on a particular topic during the role play, you should not make any judgmental comments. You should not judge them on their perspective in any way. For example, if a patient is a smoker and they've come to you about some respiratory complication or something, and they need to cease smoking, or they need to cut down on their smoking. So rather than sounding judgmental, you need to give advice in a more sensitive way. You cannot be judgmental of their lifestyle, or because they have a particular opinion or a perspective towards the condition or the problem that they have. If the patient is reluctant, in many cue cards you have where patients are reluctant to your advice, and in those cases you should not sound judgmental. You should validate their concerns, you should validate their opinions, you should express a respectful attitude. You should demonstrate a respectful attitude by saying phrases like, yes, I understand and respect your opinion. Yes, what you're saying sounds perfectly reasonable, and I know if I were you, I might feel the same way. So by using such statements, you are demonstrating a respectful attitude towards their towards their views. The fourth one is showing empathy for feelings or predicament or emotional state. This means that you have to use empathy, you have to use empathizing statements to validate the patient's concerns if they are undergoing some difficult feelings or if they are experiencing some difficult emotional states. It's good to use phrases like, yes, it must be very difficult for you. I completely understand that, and so on. And avoid repetition of phrases. So something that I've noticed in all the students is that they learn a phrase and then they try and overuse it at different stages during the role play, and that does not come across as sincere or genuine. So you need to incorporate a variety of phrases, and when you feel that the patient is stressed or is reluctant about something or is concerned about something, incorporate empathy in your speaking. The second is understanding and incorporating the patient's perspective. This means eliciting the first sub criteria is eliciting and exploring patients' ideas, concerns, and expectations. This means finding out more about the patient perspective or feelings of their illness, and if required, you can even encourage an elaboration by asking follow-up questions. Once the patient's worries or anxieties are known, then you can reassure them and construct an effective management plan. So eliciting is encouraging a response from your patient. So this sub-criteria is referring to your ability to encourage a patient response. And this is again quite important. I always teach the students to use clarifying questions or to probe into the patient concerns and the expectations or any ideas that they have about the treatment. Some examples can be asking, how do you feel about this? How does this make you feel? Does this sound realistic? So by using these examples, you're eliciting and exploring their expectations or concerns. Second sub-criteria is picking up patient cues like hesitation or change in volume or tone or pauses, or using verbal facilitation techniques like reflecting statements or encouraging patient participation. So as you know that the interlocutor cue card is different from yours, and they might, in their cue card, they might have a task in which they have to be reluctant towards your suggestion, or they might be adamant about not complying with your advice. So rather than just the content, rather than just what they say, you should also pick up some other cues, some non-verbal cues like hesitation, if they're expressing some hesitations like, yeah, I don't know, or something. So this is one example. Change in volume or tone, if you feel like they are expressing some reluctance or hesitation towards your suggestion, or if they're pausing, when you suggest something, they're pausing, they're not replying. So those are the cues that you need to pick up, those non-verbal cues. And then you should use different verbal facilitation techniques, which can be reflecting statements. Reflecting statements can be, an example can be, for example, you can paraphrase what the patient says and try to elicit their response on what their perspective is towards the condition. For example, if a patient says, I don't know, I might not do this, it sounds difficult, and then you can again paraphrase. You said that it sounds difficult. Why do you think it is? Like, what are the challenges that you think you would encounter when you're doing this? And then the third sub-criteria is relating explanation to elicited concerns or expectations. This means using the patient perspective when providing the information. For example, let's assume that your patient says that it's hard for her to take time off work, and she's concerned that she might be diagnosed with something that will have a major impact on her life. It will cause a significant change in her life. And when you're explaining the treatment advice, you could say that I know that you have a busy schedule, and I know that you're concerned about any big changes in your lifestyle. So what I suggest is that we take small steps to manage this condition. So you this is one example of where you heard something earlier during the role play, and then you related it to the you related your advice to the patient's concerns. Then the third is providing structure, and it consists of 3 sub-criteria. The first sub-criteria is sequencing the interview purposefully and logically. This means controlling the direction of the conversation and sequencing the conversation logically and purposefully. This means that you have to control the direction of the role play. You have to balance your time of 5 minutes to complete all the tasks on the cue card. But having said that, it also needs to be balanced with a patient-centered approach. It does not mean that to complete all the tasks on the cue card, you have to dismiss the patient at any stage. So you have to maintain a balance. The second is about signposting changes in topic. And this refers to signposting language using discourse markers to move from one task to another. For example, if your cue card says take history of the patient, then explain your preliminary diagnosis, then offer some lifestyle suggestions or lifestyle changes that the patient can make to manage his or her condition better. So signposting changes would be, before asking the questions, you would say, if you don't mind, I'd like to ask some questions to investigate your symptoms further. Then after the patient has answered the questions, you could say, thank you for answering my questions. Now, what I'd like to do is I'd like to talk about what I feel the preliminary diagnosis is. And after that, I'd like to explain some changes that you can make to manage your condition better. And it's important to take the patient's consent in this. It's not like you can just highlight or outline the sequence and then go on with it. You have to take the patient's consent by asking a clarifying question like, is that okay? Is that all right with you? Shall I proceed? And then the third is using organizing techniques in explanations. And there are different organization techniques that you can use. Number one can be categorization. It means talking about the categories or the sequence, how you like your conversation to proceed. For example, let's first talk about your medical history, and then later I'd like to ask some questions about your routine, including your eating and sleeping habits. And following that, I'll talk about the treatment option. So this is an example of categorization. Then labeling. Labeling means attaching the label to the advice that you give to your patient to persuade him or her. For example, it's very important that you take these, you make these changes to control your weight. The using the phrase very important, that is an example of labeling. Or another phrase that you can use is it's vital or it's imperative. So this is for labeling. You're highlighting the significance or the importance of the impact that your suggested advice would have on the patient's life. Another technique can be chunking. Chunking is breaking down the information into small pieces of into small chunks, into small groups, and then giving it to the patient in small increments. And this helps the patient to absorb each block of information. For example, if you have 3 treatment suggestions, you could say, firstly, this is one of the options. Do you have any questions? Then move on to the second one. All right, the second one is this. And finally, this is the third option. And by doing this, you're able to number one, present the information better. So you are using signposting, and you're also breaking down a lot of information into different groups. This will not only help you to complete your cue card in a very structured way, but it will also reflect that your patient will be able to comprehend the information better. Another technique, another organization technique is repetition. For example, repeating the information or summarizing the information, your interpretation at the end. Some example phrases can be, to summarize what we have discussed today, you are having problems with so and so, and after you've summarized everything, ask a clarification question. For example, is that correct? Or just to go over what we discussed today, you're suffering from stomach ache, which has been persisting over the last 3 weeks. It's accompanied by nausea and heartburn, but you don't have any complaints of vomiting, and it's impacted your appetite as well. Is that right? So this is an example of repetition. You're summarizing and giving the patient an opportunity to clarify the details or to make any corrections or add a further contribution. The next criteria is information gathering, and it consists of 5 sub-criteria. The first one is facilitating the patient's narrative using active listening. Active listening is being actively engaged in understanding or comprehending what the patient is saying. Then another technique that I can think of right now is back channeling. Back channeling is conveying back to the patient that you're understanding and involved and interested in the communication. For example, you could say, when your patient is talking, you could, rather than being quiet, you could say, uh-huh, all right, I see, okay. So this is an example of back channeling. Or you could use echoing statements to encourage patient participation, to encourage patient response. Paraphrasing or reflective statements are another examples. Paraphrasing is just repeating the information in your own words, the patient's response, to check or not what you have understood is correct. The second criteria, the sub-criteria in information gathering is initially using open questions appropriately and then moving to closed questions. So open questions are something which encourage a response more than one word. For example, could you tell me something about your complaints, or could you tell me something about your lifestyle? That's an example of open question. In contrast, the closed questions have a one-word response. And then there is another category of questions, which is called focused questions, which is a combination of open and closed questions. Where when you're training for the OET speaking subtest, it's a good idea to understand the examples of open questions and closed questions and focused questions. And then there is another questioning technique, which is called probing. So you can probe into the area of complaint of the patient further to see what their concerns are. Third criteria is not using compound or multiple or leading questions. Compound questions or multiple questions are those which ask more than one question in the same question. For example, do you drink and smoke? So this is an example of a multiple question. Another example I can think of is, did you eat your breakfast this morning and what did you eat? So this is an example of multiple question. And leading question is in which you're putting an answer into the mouth of the patient. For example, like saying, you don't have pain in your stomach, do you? So in this way, I've suggested to the patient that they might have pain in their stomach, and that's an example of leading question. To investigate the presenting problem, it's good to first start with open question and then move to closed questions. This is called the cone technique. And the fourth sub-criteria is clarifying statements which are vague or need amplification. Some clarifying statements, examples can be saying, can you please explain what you mean by, and then you can quote whatever the patient's response needs of more clarification or amplification. Or you could say, I'm sorry, but I missed the last sentence, or I missed the last part of your sentence. Could you please repeat it again? And then finally, the fifth sub-criteria for information gathering is summarizing information to encourage connection and invite further information. So an example for this can be just to go over what you've told me, then you summarize and then say, is that an accurate summary? So by this, the patient would be able to check whether your understanding of their symptoms is correct. And in case you left anything out, or in case they left anything out, they'll be able to contribute. Another example can be, so what you're saying is, and then you summarize everything that you've understood. And then would you like to add something to that? So using techniques like this, it will give an opportunity to your patients to clarify the details. They'll be able to make corrections if you misunderstood something, and they'll be able to add further contributions. And then we come to the last communication criteria, which is information giving. And this has 5 sub-criteria as well. First one is establishing initially what the patient already knows. This means assessing what the patient already knows and then giving information accordingly. So you should make an attempt to find out what the patient already knows and has an experience of, understand how much they would like to know or how much they want to know. It'll also assist you in providing the correct amount and type of information. For example, if you're diagnosed, if your QCAT suggests that your patient is suffering from this condition, so you could check their understanding, you could check the knowledge, existing knowledge that they have of a condition by asking something like, okay, I believe that you're suffering from this condition. Do you have any prior knowledge about this at all? So this example indicates that you're establishing initial knowledge of what the patient might already know, their existing knowledge. Then the second sub-criteria is pausing periodically when giving information and using the patient's response to guide next steps. So I'd like to talk about a technique here, which is called chunking and checking, which is used to provide information in small blocks of information in small increments, and then checking the patient's understanding before you move on further, before you move further. So how this will help your patient is they will be able to retain and recall the information better. And an example of this can be, for if you have to outline three suggestions to the patient. For example, if they have to modify their diet, if they have to lose weight, and they have to be compliant with the exercise program recommended by the hospital physiotherapist. So rather than saying all these 3 things at once, you should break it down and use signposting when you're doing that. So firstly, I'd like to suggest that you have to modify your diet. How do you feel about that? Or is that okay with you? So before you talk about the subsequent 2 options, you first focus on the first treatment advice, let the patient absorb it, discuss all the concerns that they might have before moving forward. So this is what it means. So I'd like to talk about a common mistake here. I see that a lot of students, when they're explaining the medical advice or even the medical procedures, they forget to translate the medical terminology into clear and simple language. So medical jargon has to be avoided when you're speaking to the patient or a patient's family members. And if you pick up a cue that the patient is being confused while you're explaining a medical procedure or a medical treatment, use it as a cue to decide what information to supply next. So if you feel that the patient is getting overwhelmed, or if a patient is not responding as actively as you'd like them to, it's a good idea to probably take it slow and then check their understanding, ask about what questions they have at that stage before moving further to complete the cue card. The third sub-criteria is encouraging patients to contribute their reactions and feelings. This means you have to encourage active participation from the patient and allow them to ask questions, allow them to express any doubt, or allow them to seek clarification regarding the information that you're providing to them during the cue card performance. And this can be done by using questions like, Do you have any questions at this stage? So when you're chunking and checking, when you're breaking down the information into different chunks, before moving forward, always check whether the patient has any questions, whether they have any doubts, or whether they have any concerns. And only after they have expressed their consent and they're completely okay with the information that is being provided, then move forward. The fourth sub-criteria for information giving is checking whether the patient has understood information. So examples can be to ensure, for example, after providing all the information that you have, you can say something like, to ensure that you've understood everything correctly, would you mind repeating back to me what we have discussed? So this is a teach back method. Rather than saying, using questions like, does that make sense? Which can make your patients a little pressurized into saying yes. It's better to check their understanding by asking them to repeat everything that you have told them. So one example we discussed, which can be like, to ensure that you have understood everything, or to ensure that we're on the same page, I'd like you to repeat back to me what we have discussed. And in case there are any gaps in knowledge, when the patient gives their response, you can always reiterate the advice again. And the final sub-criteria is discovering what further information the patient needs. This means you can ask the patient directly if they'd like to know any further information. So when you're wrapping up the cue card towards the end of the role play, you could ask directly that, are there any questions that I can answer at this stage? Are there any questions that I can answer for you? Is there anything that you'd like to ask me before we close the conversation? So that is an example of discovering what further information the patient requires. So this concludes the revised speaking criteria as well. Now I'd like you to unmute your microphones, and then if you have any questions about the listening, reading, or speaking subtest about the new format or the new assessment criteria, I'll be happy to answer those. Are there any questions that I can answer for anyone regarding the reading or the listening or the speaking subtest? All right, great. So I think that everybody is clear with this presentation that I gave. Thank you all for making yourselves available. And in case you have any questions about the new format, you can contact us on our email or the mobile numbers mentioned on the screen.